everybody. Dr. Peter Glidden here. October 1st, 2014. You know what that means. We're kicking off a month-long expose on cancer. Going to be interviewing people from all around the world, physicians from all over the world who have an eye towards effective treatments of cancer. I'm also going to see if I can get a mainstream or two conventional oncologists to debate me live on the air. That should be interesting. Nonetheless, welcome to Cancer Month, October 2014. I'm your host, Dr. Peter Glidden, your steadfast advocate for health. I'm a licensed naturopathic physician. That's ND, baby, ND, naturopathic doctor, not MD, like medical deity. There's a gigantic difference. We don't have a free medical market in the United States. We haven't had a free medical market since the early 1900s. The medical arena here has been completely dominated, co-opted, and monopolized by the MDs who have effectively kicked everybody else off of the bus of medicine through legislation. Your MD may be the nicest person God ever created, but they don't know what's best for you. They only know what they've been trained in, and as it turns out, what they've been trained in, allopathic, reductionistic, pharmaceutical-centrist medicine is the leading cause of death in the United States, the leading cause of bankruptcy in the United States. And while we have let the MDs drive the bus of medicine, our health has gone to hell in a handbasket. Autism skyrocketing. 1 out of 89 births now used to be 1 out of 10,000. Alzheimer's, non-existent. Now it's the 6th leading cause of death. Arthritis escalating. Type 2 diabetes escalating. Obesity, 1/3 of the population obese. Not just a little overweight, obese. Life expectancies shortening. Cancer remains the 3rd leading cause of death. Ever since Richard Nixon established his war on cancer, remember Richard Nixon's war on cancer, the National Cancer Act of 1971, the National Cancer Act of 1971, that's what, 43 years ago. 43 years ago. Richard Nixon declares a war on cancer, and more or less the cancer rates have remained unchanged. Let's go to the Journal of the Cancer Journal for Clinicians, the Cancer Journal for Clinicians, Trends in Cancer Mortality. The overall cancer death rate rose for most of the 20th century, peaking at 215.1 deaths per 100,000 of the population in 1991. This increase was largely driven by rapid increases in lung cancer deaths among men. As a consequence of the tobacco epidemic over the past 2 decades, there has been a steady decline in the cancer death rate as a result of advances in prevention, early detection, and treatment, including the implementation of comprehensive tobacco control. I would argue treatment has nothing to do with it, that the reason that we're getting greater, or statistically speaking, health benefits from cancer treatment is because we're encouraging people to stop smoking cigarettes, right? And this report points this out. As a result of this 20% incline, an estimated 1,340,400 cancer deaths would have occurred had peak rates persisted, have been averted. So just by getting people to stop smoking cigarettes, 1,340,400 cancer deaths over a 10-year timetable have been prevented. Obviously, arguably, prevention is a much better method here because when you look at the overall statistics of cancer occurrence, all sites combined, in 1930, for women, there were approximately 200 deaths per 100,000 people, and it's more or less the same right now. Maybe it's 175. For men, it was 160 per 100,000 people. Now it's about 225. So when you look at the overall trends, there hasn't been any real significant change in the statistics of cancer survivorship. People getting cancer and people dying from cancer, it has remained more or less a steady state equation. However, when you are the king, it is good to be the king, and when you are the king, you can manipulate the data any way you see fit because of their unbelievably piss-poor results with cancer. The American Cancer Society years ago adopted something called the 5-year survivorship scale, the 5-year survivorship scale. And what the 5-year survivorship scale argues is, well, we have such unbelievably poor treatments for cancer, and we can't cure cancer. No, nobody's cured from cancer under the MD's methodology. So rather than have that statistic remain in the record books, the MDs moved the goalposts. So they said, well, from now on, we're not even going to talk about a cure. From now on, we're going to say that if you've had cancer and you've lived for more than 5 years after your initial diagnosis, that treatment is considered a success. I'm going to pull up a statistic here from the Cancer Treatment Centers of America. Cancer Treatment Centers of America, breast cancer survival rates compared between their hospitals and overall national trends, which are on this little chart. If you're watching on the live video stream, the SEER, the CTCA in the green is the Cancer Treatment Centers of America, and the SEER is the general overall rates of all other hospitals in the United States. You can see that for breast cancer, their survivorship after a half of a year is 95%. But after 5 years, only 23% of women survive with breast cancer. And it's a downward trend. This first year, it's 88%, then it goes to 79, 67%, 59%, 50%, 43%, 38%, 30%, 26%. It continues to go down, so by year 8, 9, or whatever, you're dead from breast cancer. And interestingly enough, they do not compare this against statistics for women who did nothing. Nor do they have any mention whatsoever about what has happened to the quality of your life while you have undergone the unbelievably expensive, traumatic, and life-threatening programs developed by the MDs, and we're all supposed to rally around this flag and give these people more money. They don't even know how to cure heartburn, but we give them as much money as they ask for to come up with a cure for cancer, even though their breast cancer survival rates are unbelievably, appallingly pathetic. No different for colon cancer. 87% of the people who undergo treatment at the Cancer Treatment Centers of America are alive after the first 6 months, but after 5 years, only 10% of the people who undergo their therapeutics are alive, and after the 5th year, well, I'm just looking at the logarithmic curve here, you're going to be dead. This is okay, though. If you've lived for 5 years, that's considered a successful treatment in the upside-down, inside-out, ass-backwards world of conventional allopathic reductionism. It is a nightmare. Esophageal cancer, throat cancer, look at these statistics. Unbelievably piss-poor. After half a year, only 62% of people are alive, and after 5 years, only 4% of the people are still alive. But, you know, they've got no throat. They got feeding tubes. They got stomach tubes. They're like the Borg. Half man, half woman, half feeding tube machine, kidney dialysis, whatever. You kidding me? Oh, but this is good cancer treatment, isn't it? Oh, this is the best that money can buy. Well, guess what? No, it's not. It's mediocre at best, and they move the goalposts in order to deflect our awareness from what's really happening. Kidney cancer, survival rates, bad as well. 68% after the first 6 months, and then it dwindles to 10% after 5 years. This is a bus that has gone over a cliff in the middle of a swamp that's on fire. Pancreatic cancer, don't get pancreatic cancer. A very good friend of mine died from pancreatic cancer, was treated at Cancer Treatment Centers of America, and as far as I'm concerned, they fed him a false bill of goods. I was with him every step of the way. I heard what they said to him. I saw what they did to him. And then he died, and his wife didn't get a refund. 62% after half a year, 2% after 5 years. But this is really good, boys. This is what we have to do. We got to continue to do the radiation, continue to do the chemo, continue to do the gene therapy, even though it doesn't work. It doesn't work. It doesn't work. And I'm not the only one saying it. The Journal of Oncology, 10 years ago, published an article that looked at 14 years of data. They looked at people all around the world, adults who had developed cancer, and many different types of cancer, adult onset cancer, and who were then treated with chemotherapy. And in the Journal of Clinical Oncology, published the results, startling results. 97% of the time, chemotherapy for adult onset cancer does not work. Doesn't work 97% of the time. And in a study that's this big, there's something called a statistical error ratio, right? It's the statistical percentage that you screwed up the data, and there's a positive or minus percent error ratio. In this case, it's 3%. So that means between 94 and 100% of the time, chemotherapy for adult onset cancer doesn't work. It's clearly outlined here by the statistics given to you for free by the Cancer Treatment Centers of America. However, they don't talk about their failures. They talk about the 5-year survivorship in order to confuse the patient into getting on board with the treatment. Ladies and gentlemen, if you have a diagnosis of cancer, you have to get my book. And it's free. You can get my book for free. FreeDoctorBook.com. You think I'm selling stuff? FreeDoctorBook.com. It's free. And I have 10 questions in my chapter on cancer that you need to ask your oncologist in the presence of a recording device and a witness. And if you ask these questions politely, succinctly, and listen to the oncologist's answer, I would be very surprised if anybody with a brain would attempt their Machiavellian, monotheistic, completely ineffective therapeutics. Knowledge is power. Get some back today. Dr. Peter Glidden, fire your medical doctor. Here is the reference for the article. The Journal of Clinical Oncology, Volume 16, Issue 8, December 2004. That's 10 years ago. My bad. They collected 14 years of data from 1990 to 2004 and concluded and published in the gold standard of cancer research that 97% of all chemotherapy for adult onset cancer does not work. Now, if it doesn't work, and the MDs are all about double-blind this and prove that, and let's use the scientific method, ladies and gentlemen, then why, after this article was published 10 years ago, do they still prescribe chemotherapy and in ascending doses? Because it is unbelievably profitable. It is unbelievably profitable. And because they move the goalposts and they talk in terms of the 5-year survivorship, most patients aren't smart enough to understand this. So you're diagnosed with cancer. Your doctor doesn't talk to you about it. They don't give you a choice. They say, well, Jane, I'm sorry you've been diagnosed with breast cancer. I've set you up for full treatment starting on Monday. Clear your schedule. That's how they pitch it to you. They don't tell you about it. If you were to ask them, well, son of a gun, doc, do you know how to cure this type of cancer? What should I expect from this treatment? What's the treatment going to do to me? What type of side effects is this treatment going to engender? What's going to happen to the quality of my life? How much is it going to cost me? How much are you going to profit from it? How much is the hospital going to profit from it? I'd love to talk to 10 of your patients who have the same diagnosis and who are alive 5 years later and see what the quality of their life is like. I'd love to talk to them. Can you give me their names and numbers? People never ask these questions to the doctor. For goodness sake, we ask more questions about our automobile than we do about our bodies. You wouldn't just go to the car lot and buy the first car that the car salesman showed you. Would you do that? No. You shop. You get informed. You figure it out. You get a second opinion, a third opinion. You figure it out. The only problem in the land of MD monopolization of the medical marketplace is that when you get a second, third, or fourth opinion, they're all from the same school of thought. I mean, it's like asking, 10 different Roman Catholics what they think about reincarnation. Well, guess what? You're going to get the same answer. It's like asking 10 different communists what they think about voters' rights. Guess what? You're going to get the same answer no matter who you go to. And they all toe the party line. Oh, it's inside of a 5-year survivorship. Oh, we're going to do our very best for you, Mrs. James. We're going to do our very best for you, Mr. Jones. That's what we're going to do. When, if they told you the real situation, yeah, your personality is going to change, your teeth are going to fall out, your hair is going to fall out, there's a 37% chance that the therapy we give you is going to cause a different type of cancer in your body. You're going to need to be put on antidepressants. You're going to need to be given sleep medications. You're going to need to be given amphetamines to wake up. You're going to need a medicine to pee, a medicine not to pee, a medicine to poop, and a medicine not to poop. But we've got you covered because we have the best drugs that money can buy. And, oh, by the way, I see you have a really great insurance policy. So we're going to go over and above for you. Meanwhile, but doctor, can this treatment cure my cancer? Well, the answer is no. Doctor, is the treatment that you're going to give me possibly going to cause a different type of cancer? The answer is yes. Doctor, what was it that caused my cancer in the first place? Et cetera, et cetera, et cetera. We don't ask the simple questions. We don't ask the simple questions that we ask the car salesman when we're going in for cancer treatment. And this is why we're dying. This is why I'm here. This is why Dr. Wallach is here. This is why we're rising up above the crowd with a voice and just saying, look, ask a straightforward question, human to human, and see what type of answer you get before you embark down the dark, dark, dark road of conventional cancer treatment. Stick around. Let's go to the phones right now. They're ringing off the hook, as they do every day. Elaine from Texas is up first. Hey, Elaine, thanks for the call. You are live.
Thank you very much. I saw you at the convention, and you thought maybe I had a story to tell.
Well, hey, thank you very much, Elaine. I do remember you. I appreciate the call. All right, so I'm sitting down. I've got my seatbelt fastened. Tell the listening audience your story.
I have been a diabetic for 44 years, starting at age 29, and that was type 1. I currently wear an insulin pump, and I try to take care of myself. I do exercise, and maybe not enough, but I have been taking good supplements for about 20 years, and it has helped me to stay healthy. But I still have developed complications, and that is bleeding in my eyes, neuropathy from my feet up to my knees, gastrointestinal issues, underactive thyroid function, and frequent stress fractures in my feet. You know, cramps at night. You've had those, maybe?
Oh, yeah.
That sort of thing that has plagued me, although I'm relatively healthy for a 73-year-old with 44 years of type 1 diabetes. But I began Youngevity 90 for Life on May 1st, and I took it to my endocrinologist, or I have every 3 months I go see him, do a complete blood work, and I told him I was starting this new nutritional program, and I wanted to see if it worked, and I wanted him to document it for me. So the first few days after being on this, I got out of bed and I could feel my nightgown on my legs again for the first time in years. Then other improvements that I noticed, and this is just by the way, probably just a side effect, is that my forearms always bruised if I bumped them on anything. And I noticed that had gone away. Yay, I don't have to wear makeup on my arms to wear short sleeves. So that was, very noticeable very early on. And then I felt better. So after the 3 months of being on the 90 for Life, I went back to my endocrinologist, and we did the blood work, and my A1Cs had lowered, not quite where I need them to be yet, but lowered. My thyroid numbers were better, and my cholesterol numbers were great. I've never had a lot of problem with that anyway. But when he checked my neuropathy, they take that little nylon cord thing and just kind of drag it across your feet and legs to see if you can feel it.
Very sophisticated test, yeah.
Yes, it is. I can tell. But he had done that earlier, so he could tell the difference. I'll tell you that my legs were numb from the knees down, and when he checked that, I only had a few what I call dead spots on the bottom of my feet, and he couldn't believe it. And then he said, "What have you been doing?" I said, "I told you what I was doing." So he was very amazed, had no way to answer that, had no explanation for my arms not bruising.
Yeah.
So I am just dancing around because I feel so much better. And I really think that I have been taking good vitamins. I've been told they were good.
Right.
But I don't think they have all the minerals that the 90 for Life has.
Well, the proof of the pudding is in the eating, right? And, if anybody has half of a brain and they've gone to, medical school or they got a PhD in pharmacology or biochemistry or something, and they can talk a blue streak about any vitamin supplement and make any member of the audience think that their stuff is just the bee's knees. It's not that hard of a thing to do. However, the fact of the matter is that regardless of how good of a sales job somebody can do, how good of an advertising campaign a nutritional supplement company can have, how shiny a brochure or how fancy a video presentation, the only thing that matters is results. And I've been doing this, Elaine, for a quarter of a century, 25 years in the trenches, in the front lines, as a physician, a licensed naturopathic physician in private practice for over 20 years, treating real people with real disease with naturopathic therapeutics. And I've used many different nutritional supplement strategies from many different nutritional supplement companies, most of which you can't even get as over-the-counter at a health food store. The supplements that we're taught to use are made by companies that only service physicians. You can only get this stuff if you're a physician. So I've had access to the highest quality, arguably, nutritional supplements in the world in 25 years, and Dr. Wallach's work better. Dr. Wallach's work better, which is exactly your experience.
Yeah.
And so, regardless of what the label says, and regardless of what the person who pitched it to you said, really, in the final analysis, what matters most is results. It's that's where the rubber hits the road. Now, of course, the next question to ask is, well, has your MD become curious about learning more about longevity, or what's up with that? Where does that stand right now?
Well, I hope to make that point when I see him next in about 6 weeks. I did leave him with a Dead Doctors Don't Lie video, and when I asked him about it, he said, "Oh, I didn't watch that. It said Dead Doctors on it, so I didn't listen to it."
Yeah, so it's funny, right? And this is a big disconnect. I think that, I like having testimonials like this on the radio, because not only does it underline the potentials here that the human body has, and one of my slogans is, your body's ability to heal itself is greater than anybody has led you to believe, which is certainly your experience in the last, May, right? June, July, August, September, not, 4 months, for goodness sake.
Yeah.
So not only are the testimonials good, which underline the effectiveness of this program here in real time with real people, but it also throws a light on the peculiar perspective and the peculiar mindset that MDs bring to the table. Now, you would think that if you had dedicated your life to serving humanity as a physician, that if you had taken upon yourself that mantle, if you had taken upon yourself that responsibility, the suffering of humankind, if you had really been concerned with eliminating human suffering, and you'd been treating a patient for 20 years, and they hadn't been getting any better. They were, in fact, getting worse. They were maintaining life at a very low quality level. And then all of a sudden, in 4 months, there's dramatic, noticeable, measurable, objectively measurable improvement in a number of different clinical signs and symptoms. You would think that the physician would be all over that like white on rice and want to know everything about it. Be calling me up, be calling Dr. Wallach up, be flying out to our offices to have a sit down and talk to us face to face. This is the most remarkable thing I've ever seen. How did you do this? What's the research? What's the documentation? How do I get on board? How do I get started? You would think that they would do that, but they do not. Consistently, 100% of the time, they do not. And this is, again, one more reason to fire your medical doctor, because as God is my witness, they do not have your best interests at heart. They have their best interests at heart, and their best interests are not to rock the boat, not to do anything outside of the box that's going to endanger their ability to practice medicine. And even though their therapeutics fail, even though their therapeutics bankrupt, even though their therapeutics harm, and even though their therapeutics kill, they continue to push them out into the world. And even when they have direct experience with patients, unarguable, objectified results, they turn a blind eye. Elaine, God bless you. Thank you so much for the testimonial. Do me a favor, call me back every couple of months with an update. I'm sure the listening audience, and I know that I would love to be able to see what happens next, because I know that there's more good stuff on the horizon here for you. You are a testimony to the product themselves, and I really have a lot of respect for people like you who have taken it back to their MDs. So call me back, and I will look forward to it. And that's how they do it in Texas, ladies and gentlemen. I love the great state of Texas. If there's anybody that's going to stand up for themselves, my experience is going to be a Texan. It's awesome what you can do with the right stuff. Now, do we say that this is a magic cure-all pill for everything? No, we don't, because it's not. It's not. Tell you what it is, though. It's the next step. It's the next step. Think about it. We cleaned up the water supply. We had public sanitation, put public sanitation systems in place. We had the government subsidize farmers so everybody would have food on the plate most of the time. And by doing those three things, we doubled human life expectancy, doubled it in 100 years. Not with medicine, not with heroic interventions, not with surgery and penicillin and drugs, but with simple public health measures. Well, the next public health measure for everybody to employ: eliminate the 10 bad foods. Fill your body's nutritional tank up with the appropriate Healthy Start Pack by Youngevity, and secure a minimum of 20,000 antioxidant points a day. If you do those three things for a minimum of 3 months, it would be impossible for you not to experience a positive, measurable, noticeable, significant change somewhere in your body, mind. And then when you get positive experience like that, you just stay on the nutritional horse and see how far down the road it brings you. Oftentimes you are quite surprised at how far back your body is able to bounce when you give it the stuff necessary for life. And this is all that we do. We believe that the human body has a built-in God-given ability to fix itself. We believe that the human body is endowed with a spiritual essence. We believe that there is something inside the body which gives light to the eyes, which gives light to your dreams. You ever imagine that? Where the hell does the light in your dreams come from? And if the body is just a biochemical bag of badness that the MDs say that it is, why does the body decay after death? I mean, isn't it the same biochemistry? Well, I'll tell you why the body decays, because Elvis has left the building. The soul force leaves the body. The spiritual force leaves the body. It's gone. It's no longer in the body. And it was that spiritual essence which was maintaining the structural integrity of the body. It was that spiritual force which was keeping the whole shebang together and managing everything that was happening every millisecond of every day. Your body knows how to fix itself. Your body wants to fix itself. And all that we recommend is you take stuff to support that process. It's not that difficult. I mean, you give a plant Miracle-Gro, you give your dog and your cat food that's loaded with vitamins and minerals. Do the same for your body and get out of the way and expect a miracle. I'm Dr. Peter Glidden. Don't even think about touching that dial. And we're back live, ladies and gentlemen. Let's go to New Mexico and talk to Kathy. Hey, Kathy, thanks for the call. You are live.
Privilege as always, Dr. Glidden. Thanks for taking my call.
My pleasure. What's up?
My sister-in-law was taken to the heart hospital yesterday by ambulance with high blood pressure and chest pain. They performed a heart catheter, found no blockages, but they said the back vessel of the heart is small, so they put in 4 stents.
Well, they had to find something, right? I mean, they had to find something. So, right.
Doctor told her that she need to get on drugs and off of these vitamins that she's taking, which are longevity products, obviously. He prescribed Integralin and nitroglycerin.
Yeah.
Said her bad cholesterol is very high and her blood pressure is very high. She has not been on any previous medications.
Yeah.
But she wants to continue, obviously, and wants a protocol for what you would recommend for her to be taking or increasing or whatever the case might be to get through this.
Well, all right. So there are 2 separate and distinct things here. And just because the doctors, I mean, look, you know, the research is becoming more and more and more apparent every day that the more diagnostic stuff you do for people, the more things you're going to find and the more unnecessary procedures are going to be performed. It is entirely possible that the chest pain that she was experiencing was gastroesophageal reflux or heartburn or had something to do with her stomach and digestive tract, didn't have a damn thing to do with her heart. But they go in with the catheter and they look around and they don't see anything major, nothing major. But, you know, they feel a little embarrassed now because they did the procedure. Oh, there's a little tiny artery down there. It's, 20% occluded. It's been like that her entire life. Or it's, smaller than the last one that they did. It's just a genetic, it's a normal size for her. And, they pin a diagnosis on it, and then she wakes up and she's half gorked out of her mind post-anesthesia, and the medical doctor could tell her that he's Jesus Christ and she'd believe him, right? So whether or not her heart condition had anything to do with the blockage in the heart artery, God only knows. I doubt very much that it did because, I just don't believe him. I don't believe him. Now, high blood pressure is a completely different animal. However, as they've done with cancer, and they've moved the goalposts, they've done the same thing with cholesterol numbers, and they've done the same thing with high blood pressure numbers. So, I was taught years ago, which I believe is an accurate baseline, that high blood pressure can only be determined as a definitive diagnosis if you have had 3 consistent readings, 3 consecutive readings in a row where each number is elevated above 140/90. Each number has to be above 140/90. If just one number is above, either 140/90, you don't have high blood pressure, you're borderline. Or if not all 3 times in a row, both numbers are elevated, you don't have high blood pressure, you're borderline. And the evidence clearly shows, and I spoke about this last week, the research clearly shows now that doing nothing for people who have borderline hypertension, high blood pressure, is better than giving them drugs for borderline hypertension. Yet, the medical industry profits billions of dollars a year by giving drugs to people with borderline hypertension. So, maybe she didn't even have high blood pressure. I don't know. If both numbers were above 140/90, well, then she probably had high blood pressure. But you also have to take into consideration the white coat syndrome. She's in the back of the ambulance. They're sticking stuff in her. She's anxious. She's nervous. That's going to make anybody's blood pressure go up, right? So, did she have high blood pressure? I don't know. Did she have a real problem with her heart? I don't know. If you look hard enough, you're going to find something. And then when the doctor says you've got something, everybody believes it without question. And this is why we have such an unbelievably runaway, piss-poor, horrible outcomes here, not only in the United States, but also all around the world. Now, stick with me, Kathy. On the top side of the hour, I'm going to tell you what to do to support and promote healthy cardiovascular function because it's relatively easy. You probably already know what to do, but I'm just going to reinforce it for your sister-in-law. And by the way, I would have her get a lawyer and sue the cardiologist because he's had no training, no experience, no respect, and has no appreciation with medical nutrition. So it should be against the law for him to advise a patient about a therapeutic course of action that he has no experience with. That's my advice. Get a lawyer. Stick around. Welcome back to the second hour, ladies and gentlemen. We have Kathy from New Mexico who is on the line, been holding very patiently. Kathy, are you still there?
Hey, Doc.
All right, good. So here's the deal. I did a really good webinar on heart health, and you're an insider already, I think, right?
Yes, I am.
Yeah. So all right. So just my advice would be go into the webinars, go into your insider subscription, find the webinar that I did on heart health, and email this person. Is it your sister-in-law?
Yes.
Email her a link to it so she can have a sense of not only what to do, but why to do it. And, this is another aspect where the MDs fail miserably. They never tell people why, they just tell people what. And people bow down and genuflect at their altar and that's bad. We need knowledge as power. We need to understand why we're doing what we're doing. You need, in fact, to question the doctor. Questioning the doctor is a good thing. It's not a bad thing. And if the doctor can't handle an honest question, they shouldn't be a doctor, for Christ's sakes, or for goodness sake, excuse my French. So what we do here is eliminate the 10 bad foods, and then we eliminate the 10 bad foods. And then to support and promote proper cardiovascular function, a very good place to start nutritionally would be one Healthy Body Start Pack 2.0 liquid, one of those, one bottle of plant minerals, 2 bottles of selenium, and believe it or not, 1 bottle of digestive enzymes per 100 pounds of body weight per day. Per month, 100 pounds of body weight per month. That's a very, very good place to start. But I would add a couple of things to that, given the situation that's at play here. To that package, I would add 1 bottle of multi-EFAs, 1 bottle of multi-EFAs, and 1 bottle of Ultimate Daily Capsules. 1 bottle of Ultimate Daily Capsules. Now, have them get a blood pressure cuff at CVS or someplace. Have them take the blood pressure cuff to a firehouse when the guys are not out on call, and have the EMTs in the firehouse measure her blood pressure with their equipment and with hers and compare the results to make sure her equipment is accurate. Once she knows she has accurate readings, accurate equipment, I want her to take her blood pressure twice a day at the same time every day, and I want her to write the numbers down on a chart that she keeps up on the refrigerator. And you want to look to see, right, the numbers come down over time, even if she's on medication. And as the numbers come down over time, then she goes back to the medical doctor and he withdraws the blood pressure medication because he doesn't want her to have too low blood pressure, because that's also dangerous. Remember, people don't have blood pressure because they have a lack of hydrochlorothiazide. People have high blood pressure because their body has run out of the nutrients necessary to maintain healthy blood pressure, and taking a prescription medication for blood pressure is like sweeping symptoms under the rug. It doesn't cure anything. It just puts everything out of the way so you don't see it anymore. It's always better to attempt to support the optimal function of blood pressure rather than to suppress high blood pressure with medication. So that's where I would go. Also, it would perhaps be useful as a little bit of pearl of clinical insight here. Look up, do a Google search for circadian rhythm. Circadian rhythm blood pressure. Because the body has a natural sleep-waking cycle, right? It's called the circadian rhythm. All living things have it. Plants have it, animals have it, human beings have it. There are different times of the day and night when different metabolic processes inside the human body are increased or decreased. And there are certain times of the day, and I forget what those times of the day are, when your blood pressure is naturally increased. So she doesn't want to be measuring her blood pressure at those times of the day because she'll get a false high reading. Does that make sense?
Yes.
So
Sure does.
it's a really interesting thing to educate yourself about anyway, the circadian rhythm. So blood pressure twice a day with a good, accurate blood pressure cuff, not during the high peaks of circadian rhythm blood pressure. And, look for numbers to be consistently below 140 over 90, both numbers below 140 over 90. And if she can remember, it's a hard thing for people to do, especially after they come out of anesthesia. But if she can remember what the readings were when they took her in the ambulance, that would be very interesting information for me. If you can secure that, that might open up a whole can of worms here, Kathy. I appreciate you. Is there anything else I can do for you?
I'll try to get that for you. I wanted to ask you a quick question about my sister's brother-in-law who just got diagnosed with pancreatic cancer.
Phew.
And she's a distributor also and wanted to get him on the product, sent it to him, and he returned them back to her because he said the doctor said that they didn't want him on any antioxidants while he's going to undergo treatment.
Yeah, that's because the cancer treatment, that chemotherapy, produces oxidative damage. That's how it works. Chemotherapy is like napalm. Right, in the Vietnam War, they'd fly over the jungle and they'd drop a napalm bomb and it burns everything. It just burns everything. That's what chemotherapy does. It loads the body up with oxidative stress, so everything starts to be oxidized and everything starts to be destroyed. That's why your hair falls out. That's why your teeth fall out. That's why chemotherapy can give you cancer. The whole treatment of chemotherapy here is to kill everything in the body, including hopefully cancer cells, take you right to death's door, and then stop the chemotherapy, let the body bounce back, and hope that the cancer cells don't come with it. And that's their therapy. And it's barbaric. It's ridiculous. Why anybody in their right freaking mind would do it is beyond me. But nonetheless, that's the active ingredient methodology behind the chemotherapy. So why on earth would you, if you're giving somebody massive doses of free radicals, want to stop the action of the chemotherapy with vitamins? Because the MDs have their heads up their butts and they're completely clueless about it. And by the way, they should have told him right off the bat that their therapeutics have unbelievably horrible track record for pancreatic cancer. They're going to kill him. But before they kill him, they're going to get as much money out of his medical insurance as they possibly can. And that is the only reason that they are recommending this treatment, because of all of the types of cancer, pancreatic cancer has the worst track record. I'm going to pull this up again for those of you in the viewing audience so you can see it firsthand. This is a comparison between pancreatic cancer survival rates and the general trends in the United States. If he's not at the Cancer Treatment Centers of America, in the first half of the month, only 30% of the people who undergo the treatment survive. After 5 years, only 2% of the people undergoing the treatment survive. And I've been at the bedside of people with pancreatic cancer. It is not pretty what the treatment does to them. It is not pretty what the treatment does to them. It's barbaric. It's ineffective. And the only reason they're recommending it is to eke as much money out of his insurance policy as is possible. It's a crying shame. There ought to be a law, and somebody should go to jail. Thanks for the call, Kathy. I have to move on. Dave in the Thumb. Hey, that's the thumb, by the way, of Michigan, ladies and gentlemen, not the thumb on my hand. Hey, Dave, welcome aboard. You are live.
Yeah, somebody should go to the gallows, Doc.
No kidding. But it ain't going to happen because it's good to be king.
Unbelievable, man. I just, every time I listen, the more I listen to this crap, just unbelievable. Anyway, my buddy Bill, business partner, distributor extraordinaire. Anyway, he's got a venous ulcer. We've talked about it before. He was at the health food store today. He's over-the-road trucker back home. Truck broke down, so he was stocking up on some over-the-counter supplies, and the guy saw his leg and said, "Oh, you need some Maluka honey on that ulcer." He asked me to call you.
Well, that's interesting. Honey's an antibiotic. has natural antibiotics in it, which honey never goes bad. It's the only food that never goes bad because there's stuff in honey that kills bacteria and microbes. I mean, if you could find like King Tut honey, right? Honey that's been locked in an Egyptian tomb for 5,000 years. And if it was put in there perfectly right and, in an airtight jar, and so no air got in there, so it didn't crystallize, if you pop the top on that, you could eat the honey. 3,000-year-old honey, no problem, because it never goes bad. It's the only food that never goes bad. So this is a trick that they'll teach you in survival school, that, if you're lost in the wilderness somewhere and you fall down and cut yourself, and that you can find a beehive, and not kill yourself by collecting the honey from the bees, right? If you put the honey on the open wound, it will prevent a secondary infection from happening. So honey is useful in that regard to prevent secondary infections from happening, but colloidal silver is better. Colloidal silver is better. If I had an open ulcer anywhere on my body, every hour I'd be spraying it with colloidal silver. And when I wasn't spraying it with colloidal silver, I'd have it bandaged with gauze that had been soaked in colloidal silver. And I guess if you're covering it with a gauze that's been soaked in colloidal silver, you could spray it with colloidal silver every 2 or 3 hours. That's how I would handle that. I would do colloidal silver, colloidal silver, colloidal silver, and then more colloidal silver externally, while we are attempting to increase circulation and the health of the skin internally. And we do that, of course, by eliminating the 10 bad foods, taking the appropriate healthy pack for body weight and immune support, which in his case would be 1 bottle of Killer Biotic per 100 pounds of body weight per month. And it's never a bad idea with stuff like this to support healthy circulation. And we support healthy circulation with the Ultimate Daily Capsules. If he doesn't have colloidal silver, put honey on it, not a problema. But in my humble opinion, colloidal silver is much easier, less messy, and produces better results here. So that's how I would be leaning. Make sense?
It does make sense. I didn't know all that about the microbial properties of the honey. I knew the other stuff, but my recommendation was the silver, and he just can't get it on enough, on the road, driving that truck, and, he's got it. He's in a lot of pain, and he has to keep it wrapped real tight, and then he can't re-wrap it himself good enough, and, we had him soaking it in, tea tree oil and, putting the silver on it, and he just can't do it enough,
It's interesting, Dave. We're out of time. Walter from New Haven, Connecticut is up next. Has a question about a mouth infection. Hey, Walter, thanks for the call. You are live.
I had open heart surgery, and then I kept getting... They gave me all kinds of medication. I kept getting worse and worse and worse and worse. And then I stopped all prescriptions and went longevity. And
What
I
happened?
got better and better.
Well, better and better is better than worse and worse.
No, you saved my life.
Well, you got to love it, Walter. I get it, man. I'm with you 100%. How old are you?
I'm 82.
Just get to and how long did it take for you to get remarkably better? Was it a week? Was it a month? Was it 6 months? How long did it take?
It took several months.
Yeah.
I know it's on, about 2 or 3 months.
Yeah. Well, God bless you, man. That's really awesome. How did you find out about us in the first place?
There was a naturopathic doctor had given a lecture at one of the food stores, and he passed out some material that had that was minerals that were lacking in most people, and it came out of Dead Doctors Don't Lie, and that's when I first heard about it. And then I went to YouTube, and I started to learn more and more. I mean, you guys really have the answer. Now I got another problem.
Go ahead, I'm listening.
Yeah, my problem is this. Yesterday I had oral surgery.
Yep.
And I just told you my experience with open heart surgery.
Yeah.
So what they did, they gave me amoxicillin.
Amoxicillin, yeah.
Then they gave me Oxycodone.
Oxycontin.
Yeah, oxycodone. Yeah, that's a pain med. Yep.
Yeah,
And ibuprofen.
And ibuprofen too.
Yeah, 600. And then they also gave me PerioGuard, Colgate.
Oh, yeah.
Okay.
You must have good insurance, man, do you?
Yeah, well, I have 100% disability from the Army, so
Well, there you
it's
go.
all free.
Right.
But I don't want to repeat my previous experience. Now, what I'm looking for is a substitute for, so I don't get an infection in the mouth, and also a rinse that would work for me instead of taking these products. I read the side effects, and I think my worst enemy should take them.
Yeah, no kidding. It's crazy, right? Well, like the fella said, when all you have is a hammer, everything looks like a nail. And, this is all that these guys have. So this is all that they throw at everything all the time, whether it works or not. And this is one of the reasons why antibiotic-resistant bacterial infections are on the rise now, because of the indiscriminate wanton use of antibiotics. Now, look, sometimes penicillin, or amoxicillin will save your life, and it's awesome. And sometimes it's absolutely positively the wrong thing to take, and it's going to hurt you in the long run. The MDs, of course, have no scale to measure that, and they just throw antibiotics at everything. I swear to God, if you took antibiotics and anti-inflammatories, prednisone, away from MDs, they would not know what to do. They'd be running around like chickens with their heads cut off, and it would be a sad state of affairs. So, a good strategy here is to go to the health food store and get an over-the-counter colloidal silver, if you can find it at the health food store, called Argentyn 23, ARGENTYN 23, Argentyn 23. Now, if you can't find that, find another type of colloidal silver called Sovereign silver. Either one, I want you to take a tablespoon of the colloidal silver, please, and mix it with 1 ounce of water, 1 ounce of, purified water, 1 tablespoon of colloidal silver. I want you to put that in your mouth and swish it around in your mouth like it's a mouthwash. Swish it around in your mouth for at least 1 minute, and then I want you to swallow it. And I'd like you, please, to do that every 3 hours while you're awake for 2 days in a row. Every 3 hours while you're awake for 2 days in a row. And that's going to be better than anything that the MDs can do in order to prevent secondary infections from popping up. In your mouth or anywhere else in the body, quite frankly. And also, don't forget, Walter, of course, you need to maintain the discipline with the rest of the supplements all of the time. I'm sure you're on board with that, but the colloidal silver as a mouth rinse every couple hours is like gold. Check it out. Diane from Georgia is up next with it looks like chronic eczema, I think. Hey, Diane, thanks for the call. You are live.
Hi, Dr. Glidden.
What's up, Diane?
I'm not doing well at all.
I'm sorry to hear that. You down there in Georgia?
Yes.
Georgia, the whole day through. I know what you're thinking. Dr. Glidden, you lost your calling. You should have been a singer. I know. It's kind of tragic when someone misses their calling in life, don't you think, Diane?
No, I think you actually have found your calling in
Well, that's very kind of you to say. Enough of this foolishness. How can I help you?
Well, I have tried the longevity products a month ago, and I ran out of money, and I unfortunately did not, budget well last month. So I'm about to order it again, and I just want to make sure I have the doses right. I have chronic eczema that is all over my body, and it's very itchy, it's very painful, and it's very, just inflammation, chronic scratching all day long, all over. It's just so embarrassing, and it's very painful.
Well, I can feel your pain.
asthma, but my asthma, it seems, has been diminished because I did give up dairy. I've also given up all of the, 10 deadly foods that you mentioned. And
How long have you been off of wheat?
I've been off of wheat for about 2 months now.
Okay, good. Very, very good. You need to maintain that discipline because wheat is your biggest enemy here.
Yeah, I know.
You need to not even look at wheat. And wheat, they stick wheat in a lot of different things. Here's something I just found out. I didn't know this before, but if you go out to eat, like, at a restaurant or a buffet, or you're staying at a Motel 6 or something and you have their buffet in the morning, the scrambled eggs that they give you in those stainless steel buffet pans? Well, the egg mix that the restaurant gets at the hotel is liquid eggs. That's a combination of eggs, water, and wheat.
I don't even eat eggs, to tell you the truth. I'm not a fan. So I really have given up most dairy, like milk. I'll drink almond milk sometimes, but I don't drink.
Do you eat butter?
I have organic butter that I just bought today. Actually, it does have cows in it, but I think I forget what it says on it, that it's different from regular. The regular butter that's not organic.
Well, now what happens to you when you eat eggs? What happens?
I'm not sure, because I know I have a lot of food intolerances. So a lot of the things that show up will probably be 10 hours later. It's hard for me to really know.
All right, well,
I just gave it up because I've been listening to you and other people.
Well, don't listen to other people. Listen to me. Okay, so here's what I want you to do. Because if you're allergic to eggs, then you shouldn't eat them. If you're intolerant,
not allergic, but I don't know if I have a tolerance.
Yeah, well, we're going to find out here pretty quickly, because if you do not, given your condition, an egg would perhaps be one of the best foods you could possibly eat. So we need to figure out whether or not eggs are problematic for you, and here's how I want you to do it. Okay?
All right.
All right. So I want you to get a pot, put some water in it, and bring the water to a rolling boil. Bring the water to a rolling boil in a pot. Once the water is boiling rapidly, you put 2 eggs into it. Put 2 eggs into the boiling water, and then you set a timer for 7 minutes, and you keep the 2 eggs in the boiling water for 7 minutes. Not 6 minutes, not 7 minutes and 10 seconds, 7 minutes. You put the eggs in the water for 7 minutes.
Okay.
When 7 minutes is up, you take the eggs out of the water, you run them under cold water, you peel the shells off, and you put the eggs into a bowl. Now you have soft boiled eggs. Okay?
Oh no, I hate that. I do not like the taste of raw eggs. I tried it.
Well, these aren't raw, they're soft boiled. You can't handle that?
I can't stomach any of it.
Okay, how about, all right, very good. Well, that's, one man's ceiling is another woman's floor, right? Okay, what about scrambled eggs? Are you okay with that?
Scrambled is good.
All right, so here's what I want you to do. Forget the water, forget the pot. So you got a fry pan. You got a fry pan. And you put that organic butter into it.
Okay.
Turn the heat up really low. I mean, low heat.
Yeah.
Melt the butter. And then I want you to crack an egg into the pan and cook it, over easy. You let one side cook and then you flip it, and then you let, you cook it on so the egg, the yolk part is a little bit runny. Okay.
Okay.
Are you okay with that, or is that a problem?
I'll put probably some goat cheese on it to kind of mask the flavor.
Can you scramble it up then? Can you scramble the egg up and eat it that way? Is that more palatable for you?
Definitely. Absolutely.
All right. So scramble it up in the butter. Don't put any cheese on it. Just scramble it up when it's in the pan. But
right.
I want you to take it out of the pan while it's still moist.
Okay.
I don't want you to cook it so that it's one big rubbery mass like an omelet. Okay?
Gotcha.
I want it, like if you pick half of the scrambled eggs up with a spatula, the other half would stay in the pan, right? The eggs have to be kind of loose like that. All right.
Okay.
Good. So now we've got the scrambled eggs and we've got them on a plate.
Okay.
Good. So you sit down at the table, and you have to stay seated for 10 minutes.
All right.
So before you take your first bite of eggs, you take your pulse. You know how to take your pulse?
I do. Yes, sir.
All right. So you take your pulse, and you see how many beats per minute your pulse is. And you write
Okay.
that number down,
Okay.
71 beats a minute, or whatever. Okay?
All right.
Then you eat the eggs. Eat them all up. Finish them up. Just eat them and take about 5 minutes to eat the egg. Right? The one egg scrambled up is you can eat that in a couple minutes, right?
Yes.
Now, 10 minutes after you eat the first bite of the egg, I want you to stay seated. Do not move. You got to stay in that chair for 10 minutes. 10 minutes after the first bite of the egg, you take your pulse again.
Okay.
And if your pulse rate has increased by 10 beats a minute or more, you have a problem with whatever you just ate.
Okay. Okay. Gotcha.
Now, that's either going to happen or it's not going to happen. If it doesn't happen, then you probably don't have a problem with eggs, and I would start to incorporate them back into the diet. If, however, your pulse rate does accelerate, you probably have a problem with the chicken egg and you need to avoid it. But this is kind of a down and dirty ballpark way to figure this out. Because given your history, given your condition, eggs would be a very beneficial thing for you to eat.
Okay.
All right?
All right.
Okay, now if you're good with the egg, I want you to have at least 2 eggs a day
Okay.
in butter, and I want you to put salt on them so they taste good.
Right.
You can also put spices like garlic powder or cayenne pepper on it to make it taste better, okay?
You know what? I'm glad that you mentioned that. I could just make a smoothie and throw a raw egg in it and mask it with some juices.
No problemo. If you can do that, then I'm all good with that.
Okay, let me try that, because I am just... fried egg is better than the boiled soft egg, but
You're a tough nut to crack, Diane. Now, what's your current?
honest.
I know, I get it. What's your current body weight?
140, actually 145. I lost some weight.
Yeah, good girl. Okay, so in a perfect world, I would like to see you take 3 bottles of EFA Plus a month. 3 bottles
Okay.
of EFA Plus a month.
I have to order that today.
That's 9 a day.
9 a day. Gotcha.
With food. You want to take that supplement with food.
Okay.
Okay? I'd like to see you take, if you can afford it, 1 Healthy Body Start Pack 2.0 liquid. 1 Healthy Body Start Pack 2.0 liquid.
Okay. Gotcha.
Now, that has 1 bottle of the EFA Plus in it, so you would only need 2 extra bottles of EFA Plus a month.
I'm on it. I got that.
And last but not least, it would be,
Selenium.
selenium. 3 bottles a month if you can afford it. 2's okay. 1 at the bare minimum.
Okay. And
But
I
that's
also
all you.
have
That's all you need to do.
Okay. I also have lately been losing hair around my temple here and just thinning all over. It's horrible.
Yeah,
What
well,
do you
I'm pretty
recommend?
sure if you register as a Democrat, that'll all go away.
Well, I am registered as a Democrat, but sometimes I do Republican. I'm in between.
That was a joke, Diane. Half of my listening audience just hung up. That's funny. That was a joke. That was just a joke, friends. That was just a joke. Do not. So, all right. So, well, hair loss, we believe that chronic hair loss, anywhere in the body, the first, second, and third thing to think about is your body is just losing nutrients, right? Because the hair is non-essential tissue, and the body will rob nutrients from the hair to keep the rest of your body alive. So when people just start losing hair indiscriminately, the first thing to think about is, well, I just don't have enough nutrients in my body, period. Now, with somebody with chronic full-body eczema like you've got, you have gluten intolerance to the max, and your intestinal tract has been extremely compromised by, just some people are just way more sensitive to this than other people are. So a strategy that you need to bring to bear here is you need to be taking the liquid supplements
Okay.
in dilute doses
Okay.
over an extended period of time. So what I would do is I would put 2 level scoops of the Beyond Tangy Tangerine into 32 ounces of water, minimum,
All right.
and I would sip from that slowly all day long.
Okay. Gotcha.
And I would take my calcium dose in a little bit of orange juice immediately before bed.
All right.
And if you want to, it would not be a bad idea to put the plant-derived minerals in with the Beyond Tangy Tangerine, liquid 32-ounce solution, and then just sip from that all day long. If you extend the doses out over time, it's going to be much better for you given your history. More EFAs. Stay away from that crap. Keep your fingers crossed. Call me back in 4 weeks, Diane. I'll look forward to it. We're finishing out, folks, when we come back with Marie. Yep. Welcome back. Finishing out today's show, ladies and gentlemen. Hope you learned something. I always do. Let's go to Marie in California and see if we can't help a broken heart. Hey, Marie, thanks for the call. You are live.
Hi, Dr. Clayton. Just to let you know that my husband has congestive heart failure.
Yeah.
And so he has water in his lung. They took X-ray.
Yeah.
And the doctor gave him the high blood pressure water pill to flush out the water.
Did it work?
With his body. But the medication make his stomach really upset and, painful.
Is it flushing out the water? Is it flushing out the water or not so much?
Well, he has a swollen foot. So, that's why he need to, get the water pills. So he took 2 water pills.
Well, did the swelling in the foot go away or has it remained?
Just a little bit. It went away. It got better.
Okay.
It's been like 3 days now.
Okay. So it went away mostly or it went away just a little bit?
Not too much.
Not too much.
A little swollen. Mm-hmm.
Okay. So that's an indication because if you give that medication to a healthy person, it's going to dehydrate them. I mean, that stuff's going to suck all the water in the body right out. It's going to do that. So if that doesn't happen to a remarkable degree, it's because he's not absorbing it. Well, why isn't he absorbing it? Because he's been following the advice of the food industry for 60 years and eating all the wrong foods, which have destroyed the ability of his small intestine to absorb nutrients. I mean, he's so bad off, he can't even absorb drugs. So same thing killed Michael Jackson. So from our point of view, he needs to stop all 10 bad foods, and he needs to stop that immediately. No crying, no fussing, no complaining. He needs to stop eating the 10 bad foods immediately. You can get that list for free on my website. He has to do that, Marie, or this is not going to work. It doesn't matter how much I throw at him. Unless he stops eating those foods, this will not work. I cannot emphasize this enough, okay? Number 1, stop the 10 bad foods. Number 2, one of the main causes, clinical causes of congestive heart failure is a deficiency in thiamine or vitamin B like baby 1. So he needs more thiamine in his body, and a really excellent way to get that is with Youngevity's D-Stress. So I would recommend he take 2 bottles of D-Stress a month. 2 bottles of D-Stress a month. On top of, how much does he weigh, Marie?
110. He's 5'8".
That's easy then. So please give him 1 Healthy Body Start Pack 2.0 liquid. 1 Healthy Body Start Pack.
The problem with him is, I try to give him the liquid. He cannot take it. He gets diarrhea. So I've been giving him Ultimate Daily capsules instead.
Okay. Well, that would make sense to me because if he is only having a mediocre response from the water pill, that means he's not absorbing things, which would also mean that the Beyond Tangy Tangerine would give him diarrhea.
Yes.
So that's a direct indication, again, that he really needs to stay away from the 10 bad foods. You want to get him the digestive enzyme, the ultimate enzyme.
He's taking that. He's taking digestive enzyme. He's taking Sweeties. He's taking Prostate FX. And he's also taking the probiotic selenium.
Okay, he needs plant-derived minerals to top it off. Plant-derived minerals and D-Stress.
Okay, the plant-derived mineral, he's only take half half an ounce in the morning. That's it.
Okay, so get the plant-derived mineral capsules. You can get it in capsules.
Okay.
It's called Ultimate Minerals.
Okay.
And give him one of those capsules twice a day.
Twice a day, okay.
And because he's only 110 pounds, he can get away with one bottle of de-stress a month. Okay. That's really important for him. He needs the de-stress. He needs the plant minerals. And because of this absorption history, no kidding, Marie, I don't even want him to look at the 10 bad foods. Try that on for 2 weeks. Give me a call back. I appreciate it. Ladies and gentlemen, you've done it again. You've wasted 2 perfectly good hours listening to good old Dr. Glidden. I appreciate it more than you know. Stay tuned. The best is yet to come. This is Cancer Month. We're talking about different aspects of cancer every day, interviewing luminaries from alternative medical treatment circles all around the world this month. Tune in and turn on. I am your steadfast advocate for health, Dr. Peter Glidden. Live long and prosper. See you around campus.